I want to take a few minutes of your time to talk about a critical care presentation, human immunodeficient virus, also known as HIV. It's a clever virus. It's able to get into the DNA and RNA of the body and tricks the RNA, which is the messenger cell, to replicate it. Because it's part of the immune system, it makes the patients opportunistic to many particular disorders, some of which are pneumonia, Kaposi sarcoma, cytomegalovirus, and candidiasis, which we get through the GI tract. And these are all related to opportunistic situations of the body. It can also predispose to tuberculosis. And we'll talk about something that we can pick up for patients. Also colorectal cancers and cardiovascular disease. There are modifiable and non-modifiable. If patients have poor lifestyles, they obviously can be more predisposed to a virus. We understand how the virus replicates and can cause serious lymphatic changes in the body. One thing I want to talk about is the heart therapy and what we need to know as far as nurses in teaching patients about HIV. So I'd like to reiterate, everything with HIV is precaution. We understand, as I said, it's a clever virus and it gets into the messengers of the DNA. We use heart therapy, which are antiretroviral cocktails, and we'll talk about some of the ingredients of that. One thing you can pick up as a nurse, and this is asked many times on NCLEX, the patient goes for a TB time test, they go a MANTU test, and they have induration greater than 5 millimeters, you can suspect that they may be HIV positive. You can save a life right there. The antivirals are all in. If they're not willing to commit to the antivirals, they're not good candidates for that. You have to watch with these. Many of them are very strong protein inhibitors and viral sep. Many times these are asked interwoven into board questions. You need to check CBCs with differentials for anemia, thrombocytopenia, and leukopenia, where they would bleed and bruise. Platelets can get less than 150,000 with these conditions of thrombocytopenia. We use assays to see if a patient is HIV positive. They're called ELISAs. And we also we check viral loads. If the viral load is elevated, they have a higher amount of HIV in their body. We also use the Western blot test, which is a series of proteins that come out to tell us if they have AIDS and how prevalent it is in the body. We want to talk about sexual history with patients and make sure that they have a non-risky behavior to avoid AIDS or avoid spreading AIDS. We want to teach the patients to be very cautious. Themselves, juice, milk, bottled water, discarded after an hour. If they have animals, they don't have to get rid of the animals, but they have to make sure that whatever the animals are eating is fully cooked. They're so opportunistic that the licking of the saliva of the animals can predispose them to infection. No flowers, no uncooked vegetables. And also to clean their toothbrushes with a low bleach solution to make sure that it is properly disinfected. They need to floss their teeth. They need to avoid crowds. They need to use hot water dishwashers and hot water detergent to clean clothes. There's two sides to the HIV infection. It's empowering the patients with this disorder to prevent themselves from getting more opportunistic infection. Now with the heart therapy and antiviral cocktails, they're able to live long lives with quality of life. And the other fold is to protect those around them, because it is in blood and bodily fluids. Thank you for your time.